Well, good afternoon. Earlier this week, we received a real wake-up call. We saw from the modeling update that if we don't act now to halt these trends, we could see 1,000 new cases a day by mid-October. We could have 200 to 300 people a day arriving in our hospital ICUs. In fact, there are 732 new cases today. We're in a second wave of COVID-19, and as Premier, it's my duty to protect the people. Throughout this pandemic, we have made some tough but necessary decisions, always based on the best medical advice and scientific evidence available. And after consulting with the Chief Medical Officer and the Public Health Measures Table, we will be bringing in more public health restrictions to try to stop this virus from spreading any further. Effective tomorrow at 12:01 a.m., we're expanding the masking policies already in place in many communities to the entire province. That means wearing a mask when shopping, when taking public transit, and when at work if you can't keep 2 meters between you and your colleagues. As much as possible, we also need to limit close contact with anyone outside your households. This will be especially important to consider as we look ahead to Thanksgiving next weekend. We also have to extend the pause on the reopening of any other businesses or facilities for another 28 days. And we are bringing in additional targeted measures for hotspot areas for Ottawa, Toronto, and Peel Region. Effective at 12:01 a.m., restaurants, bars, and nightclubs in Ottawa and Peel must limit their capacity to 100 customers or less. Toronto Public Health has already decided to limit capacity to 75, with no more than 6 people per table, and each customer's contact information must be collected for contact tracing. For gyms and fitness centers, group exercise classes will be limited to 10 people, and the facility must limit its capacity to 50 people or less. For banquet halls and event spaces, they must limit to 6 people per table and have no more than 50 people in the facility at a time. My friends, this is serious. We have to offer our full support in every power possible to help our healthcare sector fight this second wave. The weather is driving more people indoors, which has led to more community spread and a surge in testing. As the weather begins to worsen, we can't have people waiting in the cold, waiting in the rain and snow to get a test. So today, we're announcing new changes to help the assessment centers get ready for the winter. Starting Tuesday, October the 6th, all assessment centers will be moving to appointment-based testing only in order for our assessment centers to make the necessary adjustments in order to winterize their operations. Beginning Sunday, October the 4th, assessment centers will not be accepting walk-ins. The vast majority of the assessment centers in Ontario that already offer testing by appointments will continue to operate as usual while we make this important transition. If you have already booked an appointment, don't worry, it will proceed as scheduled. Up to 80 pharmacy locations in Ontario will also continue to offer tests by appointment, with more pharmacies to offer tests in the coming weeks. While they transition, the assessment centers will also take the opportunity to conduct a deep cleaning. This will also give the labs a critical opportunity to clear the testing backlog. My friends, these changes are absolutely necessary. Being able to make an appointment, it gives certainty. It will make sure folks don't have to wait outside for hours. It will help us ensure necessary screening takes place to ensure those who need a test can get a test. And it will help us ensure we can get your results back sooner. We're working with our partners in hospitals and assessment centers to make sure this transition to testing by appointment is as smooth as possible. But folks, I have to ask for your patience as we make these changes. It might take a few days to schedule your test at the start, but we're working around the clock to keep those times as low as possible. We'll be adopting the latest testing technology and methods to allow us to test more people faster. I want to reassure people, the entire team at Ontario Health, the hospitals and public health staff, they're all working extremely hard. And I have to send a very special thank you. Thank you from the bottom of my heart to the incredible, and they're very incredible, lab technicians. Thank you to everyone who has been working tirelessly around the clock for months without a break to make sure we can keep testing people each and every day. Folks, these people have been unsung heroes. Thanks to them, we have done more testing than all of Canada combined. So please, if you know a lab technician, thank them for everything they've been doing. By working together and supporting them, we can keep people safe and turn the tide of this battle. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Elliott.
Thank you, Premier, and good afternoon. Protecting the health and well-being of Ontarians has been our government's top priority since the very start of this outbreak. This is our duty to the people of this province. Now, as the Premier has just outlined, we are seeing more and more positive cases, and we need to take action to break this trend and ensure we can keep Ontarians safe. To do that, we need to take hard but necessary measures. Wearing masks while working indoors if physical distancing is not possible, limiting close contact to only those in our households, and placing limits on our bars, restaurants, gyms, and banquet halls, and providing additional guidance for seniors on how to minimize their risk of acquiring COVID-19, including for upcoming annual gatherings such as Thanksgiving and Remembrance Day. These are all actions we can take that will help us to prevent further spread of the virus. We received a letter from the Medical Officer of Health for the City of Toronto requesting these measures, echoing the concerns we have been hearing from many other public health units across the province. And we are working closely with the city, as we are with all of our partners in public health, to address these concerns. We are also taking important steps to ensure anyone who needs a test can get one quickly, so they don't have to wait for long periods of time to receive a diagnosis. Moving to appointment-based testing, continuing our mobile testing and pop-up testing centers to target and reach vulnerable populations, and investing to increase our lab capacity even further. These are all steps that are going to help us identify new cases more quickly and help us to contain the spread. These measures will help us protect each other. There is a lot at stake. We need to take these very necessary steps to protect our economy, to protect our schools, and to keep everything open so that people can continue to earn a living. The reality is that these measures are necessary to protect the health and well-being of Ontarians, and of course to prevent future lockdowns. So I want to emphasize once again the need for people to continue to follow public health advice. Please stay home when you're not feeling well. Please continue to practice physical distancing. Wear a face covering when physical distancing is a challenge or where it is mandatory to do so. Remember to adhere to gathering limits and wash your hands frequently and thoroughly. These are still the best methods of stopping the spread of this virus and to protect ourselves, our families, our friends, and our neighbors. Thank you.
I guess, Ivana, before I start, folks, we went through a lot over this pandemic, and we've always been able to get over bumps and hurdles together as a province, all 14.5 million people pulling in the same direction. But I want to acknowledge our team behind us. Dr. Williams has been absolutely incredible. And by the way, they've all been working around the clock. Dr. Huyer, you've heard me refer Dr. Huyer as Dr. Dirk, same person. He's a great doctor. And you've heard me talk about a guy named Matt Anderson for so long, the CEO of Ontario Health, and talk about champions. And there's only one mistake Matt has made throughout this whole pandemic. When we first hired him, it wasn't short after the pandemic hit, and I'm not too sure the time frame, but I'm sure he didn't sign up for this. But only one mistake is he gave me a cell number, and once he gave me a cell number, that was a big mistake, because I call this guy, poor guy, Saturday, Sunday, every day. But he's an absolute champion. The reason our numbers are going up, on the testing and watching everything is between public health and Dr. Dirk and Matt's leading the charge over there. I'm so blessed, and I'm where I'm really blessed is having someone as solid as a rock as my Deputy Premier, Minister of Health, Christine Elliott. You've been absolutely incredible. Stood beside me every single day throughout this pandemic. And I just want to tell the people I'm very grateful. And behind each and every person here, there's hundreds of professionals behind them, part of their team, their associates that they work with every day, from doctors to technicians, epidemiologists, and everyone else under there. So we have a really, really solid team here in Ontario, and I just want to tell all the folks I'm grateful. Thank you so much. We're ready to take the questions.
Okay, we'll go to the phone line. First question, please.
First question comes from Mike Crawley at CBC News. Please go ahead.
Hi, Mike.
Hi, Premier Ford. I was told that before your cabinet was a proposal to declare a color-coded zone system to kind of make it clear what the level of risk from COVID-19 is in the different regions throughout the province. And so it would be a system similar to what they have in Quebec of red, orange, yellow, and green. And I'm also told that you had a conversation with Premier Legault about that kind of a system.
Yeah.
Why has the government not moved to that sort of a system, given that it would really clearly communicate to people what they should be doing, as opposed to these piecemeal changes to what the restrictions are?
So I talked to Premier Legault about this, and he said it was very, very confusing to the public, and you're constantly changing the colors. And I really like where we're going stage. We went through the stages, and now the hot areas, hot spots, we're working on. It's pretty clear. Ottawa, Toronto, and Peel, they're the hot spots. But he told me it's very confusing, and you have color changes every single day, and people are looking what color it is today. So I think we simplify it. And we work on these hot spots.
Follow-up?
If I could ask about the backlog in the tests being processed at the labs. It's now more than 90,000 people who are waiting for their test results. How acceptable is this, and what are you going to do, immediately to shrink that backlog in terms of adding some sort of lab capacity? So,
very good question. Before I hand it to Matt Anderson, I have to tell you, we were the ones, I've always said, we're going to be fully transparent. We were the ones who put that out there to get the message out to the people, Mike, that, something, we need to all work together. If you aren't showing symptoms, we're asking you, please don't go get a test. And I'll give you an example, Mike, and God bless these little hockey players. I love these hockey players, but I was told 2 full teams, fully clothed, fully in gear, showed up for no other reason. None of them were sick. They just wanted to get a test, and God bless them. Something great, good for them. But guys, we can't have that right now. And the backlog that we put out there, just to tell the people, we just need to get caught up. And again, a shout out to these lab technicians. The way I can simplify this, Mike, there's only so many lab technicians in Ontario, no matter who's standing here, and there's only so much reagent in the world. And right now, we're having a challenge, but I have all the confidence in the world in Matt Anderson, the lab technicians. We're going to get caught up. And the other areas that you've heard me talk about all the time, which is an absolute game changer, is these rapid tests or the home test, if you want to call it. There's quite a few companies, Abbott probably being one of the leaders there. Hopefully we can, and I know the Prime Minister, I spoke to him twice in the last few days, talked to Deputy Prime Minister numerous times. They're doing everything they can in moving these tests forward. So I want to thank them as well. They've done a really, really good job. But folks, just imagine if we could do these self-assessment tests, these rapid tests. Man, it's night and day. The other ones that were approved the other day with Abbott, that's going to help, but nothing like these rapid tests. And I'll pass it over to Matt Anderson.
Thank you for the question, Mike, and thank you, Premier. And I can confirm that the Premier does call me on Saturdays, Sundays, Mondays, every day, at all hours. There is no Premier and there's no one in this province who's more committed to expanding our testing capacity than our Premier. I can assure you of that. Just to answer your question and to maybe add a little bit, the Premier did an awesome job of addressing it. If we think about our 90,000 test backlog, first is that just to put it into a little bit of context, given the size of our network, we would expect that number to be more like 25,000. So it's really about 65,000 tests that we need to get caught up on and get caught up on as quickly as possible. That's going to happen in two ways. One is as we look to bring more supply online, and that means bringing more lab capacity in. We're right now working with other jurisdictions. We're working with the private sector. We're working with research facilities, universities, to see if there's any more capacity that we can bring online. Even an incremental amount of another 5,000 or 7,000 tests per day will make a big difference for us as we move forward on that. I would also say, and just echo what the Premier has said, we also are asking for folks who don't need a test to stand aside for a bit, let the folks who need the test, particularly those who are symptomatic and vulnerable populations like our seniors, we really want to make sure we get our testing directed there. So there's a demand side and a supply side, and we're working both of those. I would just add as well to the Premier's comments, there are new technologies that are coming our way. We're very excited about the PCR test that the Premier mentioned, but those are incremental steps to our existing infrastructure. The other test that the Premier is talking about, the antigen test, he uses the word game changer, and he's right. That brings in a whole new infrastructure that we don't have access to. And by doing that, we're going to be able to really move forward with our testing, taking the pressure off of our core network. All of that is probably a few weeks away. We are bringing on more capacity on our traditional network now, and we'll continue to do that in increments in the coming months. Right now, we have a challenge. Right now, we're trying to improve that by bringing on some more supply. And right now, we would look to your help on managing the demand side of that as well. Thank you.
Next question.
Next question comes from Brian Lilly at the Toronto Sun. Please go ahead.
Hi, Brian.
Hi, Premier. I'm going to admit that I'm pretty confused by all the different recommendations coming forward, the different material. Yesterday, Dr. Huyer, Dr. Dirk, as you call him, was out saying that restaurants are not a major source of COVID-19 transmission. We've got the Hospital Association saying they should be closed to indoor dining. We've got Dr. Davila in Toronto saying they should be closed to indoor dining. And today, you're announcing more restrictions. So I'm trying to understand why the focus on restaurants. If you had Dr. Huyer out yesterday saying it's not a major concern, why the change today, and what do you say to people that say they should just be closed across the entire province, effective immediately?
Well, I think I should pass this to Dr. Huyer himself. Thank you.
Thank you, Premier. Good afternoon. Hi, Brian. I'm not sure how you got that message. What I talked about yesterday was restaurants in Toronto are a significant factor, according to the Toronto Public Health. Of the 49 outbreaks that they had reviewed over the period of September 20th to September 30th, 39% were restaurants. And within those restaurant areas, there were concerns about different people working in different settings. So some would work in a restaurant or a bar and then potentially in a retail. So they would have different jobs, so intersecting with different colleagues. And they also, about 20% of those would go and socialize after together with the different groups. And then there were also concerns about how public health measures were being followed within. So I think it aligns with the recommendations or the public health measures from my interpretation. And it was also has been both staff and patrons that had been demonstrating the infections. So open to further clarification from Dr. Williams.
Yes, well, thank you, Premier, and Dr. Dirk. In that, we have sought the advice from the 3 hot zones, that's Ottawa, Peel, and Toronto. As Dr. Huyer had noted, there have been outbreaks related to institutions such as restaurants. At first, it was staff to staff, and some were moving around different places. And then more recently, patrons being impacted as well. So as a result, we wanted to bring in these recommendations, first of all, to decrease the crowding, to keep the social distancing and what's reasonable. That's why we moved down to the 100 for the 3 zones. That doesn't mean that local municipalities or local medical officers' health can even enhance that further, as you've seen already in Toronto, as the Premier noted, where they moved down to 75. A lot of facilities can't even do that with 75. It depends on the structure and infrastructure of their setting. That means keeping the tables right, 6 to a table, 6 foot or 2 meter distancing, masking when you're coming in and out of the place, stay at your table and seat there. So we're trying to do all these aspects that were related to impacting greater social behavior of our public writ large, especially in our hot zones where that kind of activity has been ramping up considerably, and we're seeing a rapid rise in the numbers in Toronto. Sometimes they feel doubling every 6 to 7 days. So we really have to move quickly to try and decrease those opportunities and to see if we can keep everybody working hard, as some have, everybody to pull together to flatten this second wave curve as soon as we can, and to help in all the other aspects.
Follow up?
Dr. Davila, in her letter that she's published now to you, Dr. Williams, she's calling for the entire province to prohibit indoor dining, to only allow individuals to leave their homes for essential trips, and to shut down all indoor classes in gyms and sports team activities. Is there evidence to support such measures? And if so, will you release it along with evidence to back up the public health measures that you're taking now? A big frustration is that these decisions are made and the public doesn't see the data to back up your measures. So are these measures she's asking for backed up by data, and will you start releasing data to support any new measures you bring in, including today's?
I'll pass out to Dr. Williams.
So to clarify, I did speak with Dr. Davila. I did get her letter. She was certainly recommending those for her jurisdiction. She said to me, I can't speak on behalf of Peel or Ottawa or the rest. So she felt very firmly that because of the rapid rise in numbers and within her jurisdiction, she was hoping for more even extensive measures to be taken. She felt she had the data that backed that up. With the restaurants and bars, as Dr. Huyer has already noted, she's seen some in group activities in event centers such as gymnasiums. She's seen some in some other sports groups and that where we haven't seen the rest of the province. So that's one of our challenges, is that we don't see the same thing throughout the province. And so we have these hot zones at the moment where nearly 70 to 80% of the cases every day ramping up. Even Toronto today makes up half of all the cases, slightly more than half. So these are the ones that are most concerning. So we take her recommendations. She's brought them forward. She gives them, we ask for evidence and data on that. We'll get that. But that's what she would like for us to consider as far as for her jurisdiction, the City of Toronto. But she was clear when she spoke to me, she was not trying to apply that to other jurisdictions, as that would be up to their local medical officer of health and their local jurisdictions.
Next question.
Next question comes from Nicole Lampa from CTV News Kitchener. Please go ahead.
Hi, Nicole.
Hi, Premier. If local medical officers of health, like in Waterloo Region or Wellington, Dufferin, Guelph, or Halton, asked to be considered to be placed in the hot zones, would the province approve this type of measure or request?
Yeah, I'm going to pass that to Dr. Williams. Thank you.
So it's a good question, and we have already had a meeting. We advised all the medical officers of the changes that were coming ahead of time. We've also asked them to say if there's data and information that you think you should be considered in there. And as again, we've said, it's data driven, and to give that information, because we need that to advise the minister and then up into the Premier and Cabinet if there's further changes accordingly. So we haven't ruled out that they can't. We've asked them to, if they are interested, if they feel it's necessary, that they have some information as well as data and statistics to show why they would need to move into that area. we would like to see that in our public health measures table, would look at that. And if we had to change our advice and further accordingly to the minister, our table and my office would do so. But right now it's in the early days, but we've made them aware of that. And we'll be listening to their advice and directions as they seek to bring down the curve in their own local jurisdictions.
Follow up.
With Thanksgiving coming up, are you asking residents in Toronto, Peel, or Ottawa not to visit family in outlying areas like Waterloo Region or Guelph and vice versa?
Well, I'll pass this to the Minister of Health, but we got to keep in mind people's mental health as well. You know how many people live by themselves or maybe live with a roommate or something and Thanksgiving, and if they keep within their social circle, but we always have to remember there's a tremendous amount of people that live by themselves. And it's very concerning, and mental health is always a huge issue. I'll pass it over to Minister Elliott.
Well, we are asking people to keep their social gatherings as small as possible as to immediate family. But as the Premier said, there are a number of people who do live alone, who are experiencing isolation. We want them to be able to have a connection to another group for mental health and social purposes. So we're just asking people to be reasonable. Please try to keep your gatherings small to immediate households as much as possible.
Next question.
Next question comes from Richard Southern from 680 News. Please go ahead.
Hi, Richard.
Hi, Mr. Premier. Just to sort of follow on that last question, I mean, you say immediate households. Does this mean, for example, I shouldn't see my mom here in Toronto for Thanksgiving, who lives in the city, but with whom I don't live with? Is that what it means? Can we see our folks for Thanksgiving, Mr. Premier?
I'll pass that over to the Minister of Health. What we're saying is keep the social circles tight. Don't go out and have the extended families of 20, 25 people. But I hear your question loud and clear.
What we're really trying to prevent is further community transmission. So we want people to keep their gatherings small, but I think I'll refer this to Dr. Huyer or Dr. Williams for further specifics on this issue.
Thanks, Minister Elliott. Dr. Williams and I work so closely together. Sometimes I seem like I'm saying his words, but I think he'll join in after me. But I think it's really important you ask the question as to whether you should go and see your mom. I think everybody has to think carefully about where they're going to and what they're doing and assess the potential risk, assess the potential chance for transmission. What we're hearing is that contacts, when a positive case has occurred, are having upwards of 25 contacts that they've exposed themselves to. That's a tremendous number. That's way more than very careful and considered intersection with others. So I need to think about what risk may be presented when you go to that setting. If you go to that setting, taking all of the precautions that are necessary to prevent any potential form of transmission. So I think Dr. Williams may have some more public health approach to it than I do.
Well, as usual, Dr. Huyer's pretty well covered everything there. We're asking people, because of the conditions and systems right now, it's like with a winter storm coming, we have a current environment we have to deal with. So you have to use precautions. We know that when we said household, because we did the circles, and people in the end of the summer into September, just to move those way out beyond what they should have done. And so the idea was that you knew who was in your group, you knew that they were not exposed to anything, you knew you didn't expose yourself. So if you're going to have, for example, we said household, you may already have a relationship with a single parent who may be living on their own, that you've always all along had them into your place, and you have maintained that sanctity of that protection because you don't want to expose them in that. So we're seeing household. We didn't get down to any tight definition. We know there's single people who have been with a group of 4 or 5 friends all the time, being vigilant and careful of what they're doing. There's, some people it's very important for mental health reasons. So we haven't gone down to really tight definition of household because we want to say smaller. You have to refocus back down because we said 10, but people with 10, another 10 and 20, 30, and they just went open on that, and we have a problem now. So we say hunker back down, pick pick your ones carefully, and especially at this time, much like I said, when there's a big winter storm coming, hunker down and be careful for the next while, because we do not want this to take off. We want to flatten the curve, and this is just another way to do that, even during Thanksgiving.
Follow up.
Thank you. Mr. Premier, just on another matter, if I may, I mean, you've spoken obviously about how tough it's been for the bars and restaurants.
Yeah.
I've heard from some here in the city this week about their insurance premiums being hiked as much as 700% in some cases, making, life almost impossible for these bars and restaurants. I'm wondering, sir, do you consider that price gouging, and would your government consider a moratorium on these insurance premium hikes for bars and restaurants?
Well, something good question, Richard. I'm not going to rail off on these insurance companies again, because I think everyone knows how I feel. But the hike their insurance policies up 700%. I know that the Minister of Finance, we've had deep discussions about this. He's in conversations with the Insurance Bureau and other large insurance companies. But again, insurance companies, this is time to help these folks out. Okay. Bottom line is, you guys are making a ton of money, no matter if it's car insurance, home insurance, or business insurance. Give these guys a break. That's my personal opinion.
Next question.
Next question comes from Sean Jeffords from the Canadian Press. Please go ahead.
Hi, Sean.
Well, hi, everyone. I wanted to ask about social circles again. I have to be honest, I'm a bit unclear about what's being communicated here today. The news release that's been sent out says that there is now a pause being placed on social circles. Is that across the province? Is that just in the hot spots? Or am I simply misinterpreting this?
No, before I pass Dr. Williams, I was on the call, like a 4-hour call, I think, with caucus yesterday, and one of our MPPs told me a story. I'm just going to share this story with you. As Dr. Williams said, pick and choose. And someone asked me about can I go see my mom? We all love our moms. I couldn't even get through a question yesterday, and I apologize. I got choked up talking about my mom. But in saying that, there's a story, caucus member told me there was a person working in one part of the province, and not knowing he had COVID, he went to go see his 84-year-old mom. Now the 84-year-old mom is in the hospital with COVID, and inadvertently, no one would obviously do that on purpose. But all we're saying is just be careful, and I'll pass it to Dr. Williams for clear guidance. I think what he's saying is just keep your circles tight now. That's what I think he's getting at. Thank you.
Yes, that's, as the Premier said, that's the real key message. We went with the social circles, and for that time in June and April, people, or I should say May and June, people picked up on it, did it very carefully, but then got a lot more casual, and I found people linking with this group or that group, and there was just a lack of adherence to the standard and the methods. So as people said, the bubbling had been lost. So we're trying to refocus that back in again. In a way that's a bit smaller than before, but then you can choose that where we're not saying an exact number. The key thing is that you want to make sure right now, with the amount of transmission, especially in the hot zones, and it's happening in various parts of the province, that you know that you have not brought it in, you will not pass it on, and the person that you're going to have involved with that in your household, because they're there in your house, they're using your washroom facilities, so you want to be assured that you have in a way a covenant or agreement with each other, that you're doing your best and utmost, so that the event that the Premier talked about, no one wants to have that happen. And we want to make sure, especially for this next time, until we get this curve flattened down again and things get safer again, we were going to have to really be focused at this moment.
Follow up.
Yeah, just guess what Dr.
Premier Ford, I have a question from my colleagues who are working on the broader international story about President Trump's coronavirus positive test. You first of all wanted to get your reaction to that, but also you had a staff member who recently tested positive for COVID, and I'm wondering if you can talk about the measures that you and your staff are taking to protect yourselves. Are you wearing masks during your meetings? Is cabinet wearing masks? Obviously you are out and about in the province. What are you taking? What measures are you using to prevent risk of spread? You and your staff.
Excellent question. I'll talk about my staff first, and that's what I was going to talk about after Dr. Williams. So we've tightened the circle up real tight down here. Everyone's wearing masks. It's mandatory to wear masks throughout Queen's Park here. We've cut it right down to a very tight group. I think it's probably under 6 people down here that we see every single day. And so it's absolutely essential. You know, as for President Trump and the First Lady and Vice President Biden, you know, everyone knows I've had my differences with President Trump. And I've called him out, but believe me, I wouldn't want this to happen to my worst enemy. And for Vice President Biden or President Trump and the First Lady, I just want to wish them all the best. Prayers and thoughts are with them. We may have our political differences, but it's no time. It's put it aside. I'm praying for all of them to get better soon. And again, I don't care what political stripe. I would not want this against my worst enemy. I can tell you that it's not good. So just a speedy recovery to anyone who has it.
Next question.
Next question is from Rob Ferguson from the Toronto Star. Please go ahead.
Hi, Rob.
Hi, Premier. Inevitably, there will be people that think that your new measures today haven't gone far enough. What do you say to them?
Well, you know something, and this is what I've said before about the health table and Dr. Williams. You know, you could go from one extreme or the other extreme. I think the health table and consultation throughout the province and caucus and cabinet and other people, Dr. Williams has come up with a very fair balance. We do have to keep the economy going. Health is the #1 priority. Without our health, we don't have an economy. But I think he's been very reasonable on be it the banquet halls at 50 or even restaurants to keep them still going. And I said the other day, the best way we can help them is keep them safe, but keep them going as well. And each local chief medical officer, all 34 of them, will have their local opinions on that. But I think they've been very pragmatic. They really have. You know, I hear I forget what they're called, the group that goes out, Freedom Fighters or something. They're showing up to my house. I get all these groups in front of my house. I don't care. You know what bothers me about that is my neighbors. They have all little kids, and you got some freedom fighters, whatever that means. I don't even know what they're up about, but there's going to be 100 of them. Guys, just to let you know, I won't be at home tomorrow, so give my neighbors some respect. I love my neighbors, and I apologize to my neighbors. This is happening to them. So that's it.
Follow up.
Yes, thank you. Just switching over to the end of walk-in testing starting Sunday and the move to appointments. What measures are in place to make sure that you know the lineup, so to speak, whether on the phone or online to get testing, are not as bad as the physical lineups have been at assessment centers? I'm not sure if they're actually, any of them are actually taking online appointments, but I did hear on the radio this morning a woman saying she was on the phone on hold for hours trying to get through to an assessment center to make an appointment for testing.
So good question, Rob. Before I pass it to Matt Anderson, you know, we're just asking as we make this transition to people that have a little bit of patience. We need to make this transition, but what it does, it gives people certainty. Nothing's worse, and as the weather changes, to be standing in line for hours if it's snowing or if it's raining and it's cold outside. It gives people certainty. What else it does, it helps get caught up with the backlog, but even more importantly, it allows us to get the results a lot quicker as well and get back to people. So I just ask for the next few days, please have patience. We're going to do everything we can. But in saying all that, we're still testing more people than anywhere in the country. Matter of fact, more than everywhere in Canada combined, we're still testing. So, you know, this guy behind me, Matt Anderson, I know I've said it before, but he has more pressure on him. I guess we all do, but he has more pressure than anything on this testing. And the guy's just stellar. I think I called you last night. What was it, 10, 11 o'clock at night, just to tell Matt, keep your head up, buddy. You're doing great, and we're all behind you. So I'll pass it over to Matt Anderson.
Thank you, Premier. As I said, I believe he's a little more generous than he needs to be. But thank you. To your question, in terms of what we're going to be able to do with the assessment centers, as the Premier said, it does allow us to screen. It does mean that people don't stand in line for 5 hours only to find out that they're not eligible for a test. So we are going to be able to do that. Through the screening, we're also going to be able to prioritize the most vulnerable and the people with symptoms so that we can make sure that they're getting a test more quickly. And also, and it's a little bit counterintuitive, but what's happening right now with so many people coming in on a walk-in basis, we're not able to distribute the load quite as efficiently as we could to ultimately get that test result back to people. And that's really where we're trying. We want to make sure that people get the test result back as quickly as possible. So even if it might feel like if I went down to an assessment center, I'm waiting for a few hours to get the specimen collected, and now I'm going to wait until tomorrow to get the specimen collected. But by doing it through this system, we're actually going to be able to shave off some of the testing time on the other side. So you'll get that result faster once we have this in all across the province. And that's really our goal, to make it easier, faster, and to make sure that the people who really need these tests are able to access them. Thank you.
Next question.
Next question comes from Elizabeth Payne from the Ottawa Citizen. Please go ahead.
Hi, how you doing? Hello?
Elizabeth, go ahead.
Hi, sorry about that. Can you hear me?
Yeah, I can hear you, Elizabeth.
This morning, Ottawa's medical officer held a press conference and said the health system in the city is in crisis. The testing system is near collapse. I'm wondering whether the measures announced today go far enough to make a difference in Ottawa.
Well, I'll pass it to Dr. Williams. Thank you.
And I'll make a few comments, and I'll ask Dr. Huyer to follow up on that, because we've had conversations extensively with the medical officer of health, Dr. Etches, and their team, as we seek to look at these capacity issues, be it testing with Mr. Anderson talking about that, be it in the hospital sector, again, back to Mr. Anderson's area and the long-term care with long-term care facilities. Different components that the Premier and the Minister were talking about yesterday and the day before to alleviate these issues there. They're coming, they're moving on that, as well as looking at how we do the case contact management, supporting the staff at a place like Ottawa Public Health that are getting overloaded and worn out. And so we're trying to move quickly to bolster that up with various system enhancements. So, but I'm going to ask Dr. Huyer to add a few more comments, if that's okay, to comment about the situation in Ottawa.
Yeah, I'm going to pretend that I'm Dr. Dirk for a moment. So it's Matt Anderson speaking. I just wanted to add to what Dr. Williams just talked about. I believe it was yesterday morning, myself, Dr. Huyer, Dr. Williams, and Deputy Angus met with the health system leadership from Ottawa. They put out a plan of the number of things that need to be done to try to create some more capacity and give some relief in the city of Ottawa. That plan was very, very reasonable. It included looking at how can we create more capacity immediately in our long-term care and in our hospitals. And Deputy Angus is moving on those, I believe, as we speak, to move that forward. Also on the testing side, we are looking at, and going back to the earlier question, this again goes back to the concept of having scheduled appointments. It allows us to move testing around. So when we collect the specimen, we want to get it to the testing center or the lab that can process that test the fastest. Right now, what tends to happen is we just send to the local lab, but that lab may be overloaded. In the case of Ottawa, we've seen quite a bit of pressure on our local labs. Through the scheduled mechanism, we can look at moving some of those specimens to other labs, be they be Kingston or somewhere else, shaving some time off. Instead of sending them to the lab, they sit at the lab, they then get distributed to another lab. We want to get them to the lab that can process them as quickly as possible. So all of those steps are in place to try to support our friends in Ottawa. They presented a wonderful plan, and we're going to support them in every way we can.
Follow up?
Yes, I'm just wondering, people are being told today to limit close contact to only those in their household as much as possible. Is that a mixed message when banquet halls, even with reduced numbers, bars and restaurants remain open? How do you limit that contact if you're going to a bar or a restaurant?
I better send it to Dr. Williams. Thank you.
So we have put in place these recommendations because in your household, usually around 6, 7 people, and there's different numbers that are in there. You know who they are, you're familiar. Often people will go to the restaurant with their family and they're supposed to be at a table with 6. There's supposed to be the distancing maintained at the same time. Same as you're going to a banquet or event, we ask you again to sit at a table with 6. Keep the distancing, wear the masking if you're going to be moving around, and keep the social distancing. So this is this concept of keeping these number of contacts down to those you know, and limit your moving around and your exposure to others, and you exposing them to yourself. So this is consistent with that, and we hope to have the public really focus on that aspect in the next number, especially the next 4 weeks ahead as we seek to bring this under control.
This will be final question.
Last question comes from Jeff Gray from the Globe and Mail. Please go ahead.
Hi, Jeff.
Oh, hi. Thanks for taking my question. Mr. Premier, critics have been pointing to these warnings from the Hospital Association. We have another one from the nurses, the Ottawa Public Health today. Are you willing to acknowledge some of what your critics have been saying is true, that whatever plan you had in place for a second wave has clearly been overtaken by events?
I totally disagree with them. You know, we've been working around the clock. We've had this plan for a few months now, and let's just talk about our plan. We're putting in 5.1 million doses for the flu shots. We're putting over $1 billion into testing and tracing, contact tracing, which is incredible. We put $500 million into long-term care. We're hiring 3,700 more healthcare workers. Sorry, 3,700 more healthcare workers. Our plan is working. We're making sure that we're testing more than anyone in the entire country combined. And even under the constraints and under the pressures of a worldwide reagent, per se, everyone's having a run on reagent, along with having these lab technicians, like God bless the lab technicians going around the clock. You know something? I believe it's a great plan. It's the best plan in the country, and I'm thankful that we have these people standing behind me and their teams behind me. So it's never a decision of one person or even the 4 folks behind me. It's a team approach, and we consult and we collaborate. And not to mention my conversations with the federal government and all the other premiers yesterday. And I got to give a shout out to Premier Blaine Higgs for saying, hey, New Brunswick's open. Doug, we're short on reagent, but our testing abilities are here. Send them to us. Stephen McNeil, Premier Stephen McNeil, Nova Scotia, thank you so much for your support, and Premier Moe and Premier Kenny. Everyone's pitching in. I remember when we were short the PPEs, Premier Kenny sent I think a plane or a few truckloads to help us out. We're all Canadians. We're all in this together. And you know what I find is it's so easy when you aren't in the trenches to sit back and be the armchair quarterback. And we're doing, as a province, as a people, 14.5 million people. And I say, play the smallest part in this. Everyone's pitching in. We're doing good. Did everyone, let their guard down out a little bit when we had under 100 cases? Everyone thought it was okay. Yeah, some people did. And now we have to get through this again, like we have with everything else, folks. We've done it before when we hit hurdles, and we're going to do it again with your support. And I'm grateful. So,
follow up.
If I could get you to respond to something else that the critics have been saying over the past few weeks, and by critics I mean also ICU physicians, epidemiologists. They're concerned about, so the government's been too opaque about what external independent scientific advice it's getting. I wonder if you could talk a little bit about what kind of advice the government is getting. And 2, similar to seeing Dr. Davila's letter today with these measures that she wanted to see, shouldn't we be able to see what measures the public health table and Dr. Williams recommend to Cabinet before Cabinet decides on them? Would you be willing to make those public?
Yeah, well, first I'm going to hand it over. Before I hand it over for Dr. Williams, I have a great deal of respect for all the doctors and nurses and I've been thanking them day in and day out. But no matter if you have any group, be thousands of great doctors we have in Canada, or any other organization, I could pick out a few that may disagree. And keep in mind, we have some really tough cabinet and caucus meetings. Believe me, it's not everyone's not on one way or the other. We have some really deep conversations and holding each and every one of us accountable. I can assure you that when you have a 4-hour cabinet meeting and a 4-hour caucus meeting, it gets everything on the table. So everyone's listening and we're collaborating. And at the end of the day, we're in this together and we're going to get through this together. So I'll pass it to Dr. Williams.
Well, yes, and as the Premier said, it's a huge team. And as far as people saying, look at external scientific documents, we're looking at scientific documents all the time. We're looking at the quality of those documents. Are they peer reviewed? Have they been assessed correctly? We have our teams looking at, there's a surveillance group, there is a testing group, there's a scientific table, there's the work of the modeling with Dr. Brown, and we did a session earlier this week with Mr. Anderson, Dr. Brown, and myself. Their modeling people are looking at scientific documents. We have our federal, provincial, territorial meetings, and they have huge committees and groups looking at all the scientific documents coming in. This is new. This is unprecedented. We're looking at all the material coming in, one, to assess what's the quality of it. Is it good? Is it peer reviewed? Does it make sense? And sifting that through. Nothing's thrown out. We want to look at all the information that's there. Sometimes people on the outside said, well, I read 2 or 3 articles. I think this is where it's at. They need to look at a lot more articles too. And I think that's part of the overall broad review. So as the Premier said, we're backed by a whole team, and we have Public Health Ontario, we've got the Schools of Public Health. I talked to another scientist yesterday, wanted to give me his perspective. I'm open to hear what they have to say. And again, we vet that through our groups to hear what it is, because I really depend heavily on their review of all these matters, live time basis, to go it again and review it. So it's not a closed shop at all. And we'll keep on top of it as the science is rapidly evolving, and we're looking forward to even better research, more material to come ahead. We welcome it all.
Thank you, everyone.
Thank you, everyone. Have a safe weekend. Stay safe out there.